Good afternoon. Thank you so much for joining us today. My name is Dr. Tracy Smith, Director of Community Health and Programs at Illinois Public Health Association. I welcome you on behalf of our organization, the Illinois Primary Health Care Association, OSF Healthcare, and our growing network of community health workers across the state. We thank you for your time and that of our partners at VNA Healthcare, who graciously agreed to host us for this occasion. The VNA Healthcare organization holds a 100-year record of supporting Illinois residents through key healthcare milestones throughout history, including the influenza pandemic of 1918. 103 years later, in the age of COVID-19, there is still a need for service-oriented work that happens right here daily, for equitable access to trusted health guidance and resources for the residents of Illinois who are most vulnerable. We acknowledge this need as we introduce today the COVID-19 Pandemic Health Navigator program. This program is now live and available to assist all Illinois residents in regions 2 through 9, launched by IPHA and IPHCA with funding provided by the Illinois Department of Public Health. This new program integrates local health departments, community-based organizations, and public health partners to coordinate Illinois resources to reach the most vulnerable populations impacted by the COVID-19 pandemic through a grassroots approach. Today, 65 community-based organizations and 23 federally qualified healthcare centers are involved in the program. Having recruited more than 400 individual supervisors and community health workers, we are proud to have served more than 1,270 requests for resources with a 96.5% completion rate within 48 hours of those requests. These workers have helped individuals who have tested positive for COVID and their families by connecting them to services for food, rental assistance, utilities, educational resources, and so much more. Extensive market research led us to this moment. From the name of the program to our methods of outreach, every aspect of the Pandemic Health Navigator program is based on real-time data from Illinois communities. For example, in our recent survey of more than 800 Illinois residents, 1 in 5 respondents said they were not able or unsure of their ability to tell the difference between scientific facts and misinformation on the internet. 21% said they would not get the COVID-19 vaccine. And over half, 57% of respondents, stated they would be open to working with a navigator. Our data shows that Illinois residents need guidance, broad community resources, and support in navigating misconceptions and the complexities of the health system. But data only tells part of the story. Today, we have a community health worker from one of our partner CBOs, 5th Street Renaissance. I'm pleased to introduce one of the supervisors in the Pandemic Health Navigator program, Linda Lawson.
Thank you, Tracy. I'm honored to be here today to share some of the stories about the wonderful work we've been able to do at 5th Street Renaissance in Springfield and throughout regions 3, 4, and 5 with the Pandemic Health Navigator program. My name is Linda Lawson. As a regional supervisor in St. Clair and Madison counties, overseeing a team of community health workers, we have already seen the impact this program is having on real people and real communities. In terms of services, we are supporting people with requests for food, utility assistance referrals, and other basic supplies, things that have been most hard hit by this pandemic. There are cases where people need items as simple, but we know as critical as disinfectant for their homes because they're isolated. They can't get out. Sometimes whole families have been infected and need help. By far, most of the requests for assistance have come from folks in isolation or simply don't have the transportation or physical ability to get out. We recently helped an 89 and 90-year-old couple who needed food delivery. We also brought them Easter dinner. And to put that in perspective for you, our grandparents were almost 93 and 98 years old when they drew their last breath under our own roof. They never had to worry one day about whether they would have a meal to eat. So put yourself in this couple's shoes that you make it to 89 and 90 years old, and you have to worry about where your next meal will come from or if you have access to food. We're also helping with mobile vaccinations for people who can't get out of their homes. We've made connection with a nursing agency who will vaccinate our in-home elders within certain zip codes who are unable to travel. The first one happened this past Thursday, and it was such a relief to her child as her caretaker. We're hoping for greater expansion of this in our other counties. One of our local grocery stores, Neighborhood Marketplace, was excited to hear of our program. The owner, Sterling Moody, asked for assistance to help those in his store with vaccinations. Many don't realize how this has affected not only people's physical health, but their mental well-being. And when you're dealing with all of this, and then you're scared that you can't even meet your basic needs, it can feel hopeless. They are so grateful for the Pandemic Health Navigator program and these services. We've actually had people to cry on the phone because they saw someone who cared and they knew they weren't alone. This program is already having an impact, and nothing is more gratifying than to be able to touch someone's life like that and let them know that someone cares. We look forward to continuing the work at Fifth Street Renaissance and the Pandemic Navigator program, Health Navigator program, supporting any and everyone that needs a helping hand. Thank you all for your support. Sorry.
Thank you, Linda, for sharing your stories and the experiences of working with residents in your community in the Pandemic Health Navigator program. Today, we are pleased to share how the Pandemic Health Navigator program positions more communities for recovery as we overcome this crisis. Now it is my honor to introduce and welcome Illinois Governor J.B. Pritzker to share how our program supports the state's response to COVID-19. Governor?
Well, thank you very much, Tracy. Thank you for the amazing work that you and your colleagues do. I especially want to thank the Illinois Public Health Association, who is really helping so many of our residents all across the state to remain healthy. I also want to thank Linnea Wendell, along with our Aurora Mayor, Richard Irvin. Congratulations on your reelection, Mr. Mayor. And especially to them, I want to thank them for hosting us here today. This is an important day for all of us. It's a pleasure to be with you, the Illinois Primary Healthcare Association interim president and CEO Cyrus Winnett, and with the Illinois Migrant Council president and CEO Maggie Rivera, to mark this exciting development in Illinois' public health landscape. I want to give a special thanks to two state representatives who are here with us representing the area. Of course, Stephanie Kifowit, with whom I've worked for a number of years now and who's a terrific advocate, not just for her constituents, but for veterans all across the state of Illinois. And to Representative Hernandez, thank you very much for your leadership and your partnership in Springfield. It's always a pleasure to be in both of your districts. Throughout our administration of the COVID-19 vaccine rollout, my focus has been on making this vaccine as accessible as possible for all of our residents. And thanks to the great work of our Illinois National Guard, our local health departments, our pharmacies, and of course our team at IDPH, Illinois has administered over 9 million doses of this life-saving COVID-19 vaccine, with 56.8% of those 18 and over having received at least a first dose, well above the national average. Illinois has also vaccinated 37% of our residents fully. However, making vaccines available is only half of the battle here. A year into this pandemic, many of our residents might still be unsure about the risks of COVID, or maybe wondering if the vaccine is really worth it, or if it's really available to them, especially if they've been denied easy access to health care in the past. And for others, misinformation, packaged as truth-telling on social media, makes the decision to get vaccinated nerve-wracking. A critical component of getting Illinois out of this pandemic and keeping people safe and healthy is breaking down those barriers. That's why I'm very proud today to announce our Pandemic Health Navigator program, which is already hard at work building confidence among our unvaccinated residents, educating them on what COVID-19 really is, what the vaccine can do for them, and how they can protect themselves and their families. This program is about one-on-one connections involving established, trusted members of the community, whether that's a federally qualified health center or a church or an LGBTQ plus center, a senior center, or a local branch of the NAACP. These are local community organizations who know their peers, their students, their colleagues, people who speak their languages and know their neighborhoods. When someone tests positive for COVID-19 or comes in contact with someone else who has, Pandemic Health Navigators are there, ready to assist with social service supports, personal care education, vaccine access, and even critical logistics like ensuring access to groceries and food when a person has to isolate. In short, our Pandemic Health Navigators are a crucial part of keeping our most vulnerable residents safe, and I'm very, very grateful to all of these navigators. I also want to personally thank Elisa Lara, a bilingual community health worker and a Pandemic Health Navigator here at VNA, who will talk more about her work in just a moment, as well as Linda Lawson, who just told us about her work as a Pandemic Health Navigator at 5th Street Renaissance. And her leadership really there has been vital. We couldn't do this without any of them. And again, I want to express my gratitude and admiration to all of them. So with that, I'd like to turn it back over to Tracy. You don't look at all like Tracy.
I am not Tracy. We'll switch it up a little bit. My name is Cyrus Wynn. I'm the President and CEO of the Primary Healthcare Association. Thank you, Governor. We're honored to have you join us here today and for your leadership in this critical mission. At the heart of the Pandemic Health Navigator program is a desire to reach our state's most in-need populations. It is imperative that we go above and beyond the support of healthcare needs of our communities to meet the healthcare needs of our communities, especially the Black and Latinx communities that have been disproportionately impacted by the COVID-19 pandemic. While services offered by local health departments can vary, the PHN program seeks to reach populations that are not currently accessing or seeking quality care, including but certainly not limited to racial and ethnic minorities, rural communities, people experiencing homelessness, members of the LGBTQIA community, and more. By collaborating with community-based organizations and local health departments, we are identifying gaps in services and providing much-needed resources to people who need them the most. We know that there are plenty of misconceptions around the pandemic and the vaccine, as well as a deep history of medical distrust that triggers hesitancy in marginalized communities. What's more, we understand that the acts of quarantine and self-isolation can pose a hardship to members of vulnerable populations. That's where our network of CBO partners and community health workers comes in. Entities who have an ear-to-the-ground assessment of the unique needs of the populations they serve. We are proud to team up with community-based organizations who have been and continue to conduct grassroots outreach and to help train a workforce designed to address unmet needs. From physical needs like finding primary care provider or a testing facility to socioeconomic needs like safe shelter and food security. Our community health workers are trained to connect Illinoisans with resources that ease burdens associated with seeking care, quarantine, and isolation. It's my pleasure to introduce today's host and host organization, Linnea Wendell, CEO of VNA Healthcare, to share more on what this partnership looks like. Thank you for your support and for rallying around us in this endeavor.
Good morning and welcome everyone to VNA Healthcare. We are thrilled to host all of you here today and thank you for joining us in support of this very important program. My name is Linnea Wendell and I'm the President and CEO of VNA Healthcare. VNA is so grateful for the trust that has been placed in our organization for over 100 years. As the largest federally qualified health center in suburban Chicago, we are honored that over 74,000 people turn to VNA for their medical care and other health care services each year. Over 63% of VNA's patient population is Hispanic and 14% is African American. At the core of VNA's mission is the commitment to decreasing health disparities and improving health equity. VNA physicians and nurse practitioners have provided in-person care, telemedicine, COVID tests, and education throughout the pandemic, working to minimize the effects of COVID-19 among vulnerable populations. VNA's vaccination campaign is in full swing, and VNA registered nurses have administered over 30,000 doses so far. And now, VNA's community health workers in this Pandemic Health Navigator program will provide important information, identify health care and other needs, assist with medical, testing, vaccine, and other appointments, and ensure the transportation to those appointments, provide practical assistance with basic necessities during periods of quarantine or isolation, connect individuals to other community resources, and much more. By the end of 2021, 48 VNA community health workers are expected to have coordinated services for over 70,000 community members who have been impacted by COVID-19. No one can speak about the Pandemic Health Navigator program and its impact better than those who are on the ground doing the work every day. And that's why I'm so thrilled to bring up Elisa Lara, one of VNA's community health workers, to talk a little bit more about the program. Elisa?
Good morning. My name is Elisa Lara, and I am a community health worker and part of the Pandemic Health Navigator program at VNA Healthcare. I am very humbled and excited to be part of the program and to share a few stories with you today. How this program has already helped members of our community since it's launched. VNA received an urgent referral from Kane County Health Department one night about the Kapoor family, 2 parents, 3 children, and a grandmother who all lived together. The entire family had tested positive for COVID-19, and since they only speak Punjabi, they were struggling with linguistic barriers. On top of the stress that comes the following isolation guidelines. With the help of our translation line, our VNA pandemic community health worker reached out to the mother of the family, who was very stressed and upset about how her family was going to get through this isolation period. Being new to the area, they had no family or friends nearby to turn to. They were very rapidly running out of food. Our pandemic community health worker quickly began problem solving, reassuring the mother and finding out what assistance would be most helpful. After confirming that they had a doctor and didn't have any unmet health care needs, they spoke about the meals that the family usually eats. And by the end of the conversation, they had a plan. The community health worker ordered groceries and supplies online, including disposable cutlery, plates and bowls, hand sanitizer and wipes, and the following morning, several bags of family foods and other useful items were delivered to the family's home. By addressing these needs for the Kapoor family, the Pandemic Health Navigator program was able to free them from worrying about putting food on the table and allow them to focus on recovering. Another great example of how our community health workers operate through the story is Betty, a 79-year-old woman who can't drive. She was referred to us because she was wanting to get vaccinated, but she had no idea how to schedule an appointment, no access to technology, and no way to get to a vaccination site. Betty was so relieved when she heard our VNA pandemic health worker explain to her that VNA could vaccinate her from the comfort of her own home. The healthcare worker was able to schedule her appointment quickly. The next day, VNA home care team who came to her home and vaccinated her there. Betty is now fully vaccinated and is able to begin enjoying her life after a long year of loneliness and isolation. These are just two stories of the impact of our community health workers have made since we got to work. And we look forward to continuing to meet the needs of our neighbors, like the Kapoor family and Betty, as we provide assistance and navigation to resource through this important program. Thank you.
Thank you, Elisa, for sharing those stories. And thank you to the Illinois Department of Public Health for their support of this program. And thank you to the Illinois Public Health Association and Illinois Primary Healthcare Association for leading the charge to establish a statewide network of navigators to provide information and services that empower Illinois residents and move us forward toward full recovery. With that, I am pleased to introduce Mayor Irvin.
And thank you, Linnea, for being a dedicated community partner. Our vaccine progress in Aurora is due to VNA Healthcare and your leadership. Thank you very much. And thank you, Governor Pritzker, for being here today. It's always a pleasure to have you back here in Aurora, and for making Black and Brown communities a priority for health care equity. You were here when we kicked off our Equity Focus Initiative at Black Vax Aurora in early March, and your announcement today builds upon our collective foundation in equity and inclusion. Thank you, sir. The Pandemic Healthcare Navigator program represents the best of what's possible when the public sector, healthcare, and community organizations come together to invest in the futures of our community. Thank you to the Illinois Public Health Association and Illinois Primary Healthcare Association for your leadership and service for building a network to help struggling families through collaborations with local organizations like VNA Healthcare. VNA Healthcare has provided all vaccines for Aurora's equity-focused vaccine initiatives for our minority communities, including Black Vax Aurora, Latin Vax Aurora, and Indian Vax Aurora. Together, thousands have been vaccinated and caused a ripple effect that increased vaccine equity and decreased vaccine hesitancy in our most impacted communities. Yet, there is still much work to do. And the Pandemic Healthcare Navigator program will help us close those gaps in service and as we continue to forge through the COVID-19 pandemic. You have the full support of my office and the Aurora City Council, some of which our council members are present today. Let's give a round of applause for Ward 1 Alderman Emmanuel Yamas, Ward 2 Alderman Wani Garza, Ward 7 Alderwoman Chiquita Hard-Burns, Alderman at Large Sherman Jenkins, Ward 10 Alderwoman-elect Shweta Babe, and Alderman at Large-elect Ron Warman. They have all been instrumental in advancing our vaccine equity initiatives in our minority communities. As one Aurora, we can all agree on this. No matter your circumstances, every person deserves access to health care, food, and resources needed to recover from COVID-19. And every person deserves information to make empowered decisions when it comes to protecting our most vulnerable and getting a vaccine. The Pandemic Healthcare Navigator program helps to accomplish just that. Thank you to our community health workers for standing in the gap and sharing your time and talents. You are heroes and sheroes who lead with purpose, passion, and professionalism. You are hope in human form. Thank you. And speaking of sheroes and heroines, it is my honor to bring to the podium the CEO of the Illinois Migrant Council. Please welcome Maggie Rivera.
Thank you, Mayor Irvin, and good morning, still morning. And thank you to the IPHA and IPHCA for the opportunity to share our role in this meaningful program. I am Dr. Maggie Rivera, CEO President with the Illinois Migrant Council. We are a community-based, not-for-profit organization with the primary mission of promoting employment, education, health, housing, and other opportunities for migrant and seasonal farm workers, immigrants, and refugees across the state and their families to achieve economic self-sufficiency and stability. Since 1966, we've been passionate about connecting this population with resources, and that need has only increased in light of COVID-19 pandemic. As such, we were honored to join forces with community health centers and public health agencies as part of the Pandemic Health Navigator program through regions 2 through 9. In addition to expanding our ability to support more families, we greatly appreciate the opportunity to invest and develop community health workers. Their natural passion for people, coupled with the technology and systems our public health partners have in place, are just what we needed to elevate the outreach during this pandemic. We can thank the IPHA and IPHCA enough for coming alongside to us to support the work we're doing with this deserving population. As the PHN program evolves, we are eager to side with the change makers in these unprecedented times. Before I hand this back to Dr. Tracy, I would like to have the opportunity to say this in Spanish. Hola, soy la doctora Maggie Rivera con el Concilio de Campesinos de Illinois. Somos una organización comunitaria sin fines de lucro con la misión principal de promover el empleo, la educación, la salud, la vivienda y otras oportunidades para que los trabajadores agrícolas migrantes y de temporada y sus familias, además de inmigrantes y refugiados, logren la autosuficiencia económica y la estabilidad. Desde el 1966 nos ha apasionado conectar a esta población con los recursos y esa necesidad solo ha aumentado a la luz de la pandemia del COVID-19. Como tal, tuvimos el honor de unir fuerzas con los centros de salud comunitarios y las agencias de salud pública como parte del programa Navigator de Salud Pandemia en las regiones 2 al 9. Además de ampliar nuestra capacidad para apoyar a más familias, apreciamos enormemente la oportunidad de invertir y desarrollar trabajadores comunitarios de la salud. Su pasión natural por las personas, junto con la tecnología y los sistemas que nuestros socios de salud pública tienen implementados, es justo lo que necesitábamos para elevar nuestro alcance durante la pandemia. No podemos agradecer lo suficiente al IPHA y la IPHCA, por sus siglas en inglés, por acompañarnos para apoyar el trabajo que estamos haciendo con esta población tan merecedora. A medida que evoluciona el programa PHN, estamos ansiosos por podernos del lado de los agentes del cambio en estos tiempos sin precedentes. At this time, I would like to give the podium back to Dr. Tracy Smith so that she can provide us with the closing remarks. Thank you.
Thank you. As we conclude today, we thank Governor Pritzker again, along with all of our partners, as the COVID-19 Pandemic Health Navigator program officially springs to life. Support is now available to all Illinois residents in regions 2 through 9 via our Community Health Worker program. We appreciate your time and would be happy to take any questions. Thank you.
Sure. We're in an interim period right now where demand and supply, roughly speaking, have met one another, and supply will soon exceed demand. And so we've made sure that we're, the counties, the county public health departments that no longer need replenishing of supplies, at least at the moment, are not taking new vaccines. And instead, those vaccines are going to areas where there is still higher demand. Although, as you've seen, even in Cook County, we've now been able to open up Cook County to walk-up vaccinations, which is terrific. More and more that's going to be available. That means that we're going to be able to do things like make sure that your personal physician at some point will have vaccine available to them in their doctor's office, just as they would during a flu season. But we're not quite there yet. We still have more vaccine we need to see coming into the state, and of course with the replenishment of supply that comes from the availability of Johnson & Johnson, that makes it more possible. And I'm looking forward to a point where anybody and everybody who wants to get a vaccine can literally decide to do it and go get it at the moment that they've made that decision. Well, let's start with the idea that, as you know, they're saying anyway that reaching herd immunity really, is 70 to 85%. So we're on our way there. We certainly have some time and effort that's being put into getting to that point. I think, as you've seen, vaccine hesitancy has diminished over time. I think we all know somebody who at the beginning said, I don't think I want to get this vaccine. And then as time has gone on, they've known people, they have friends or family members that have been vaccinated, and then maybe a month later you run into them and they say, yeah, I think I'm going to go get my vaccination now. So we're seeing more and more that people are vaccine confident and therefore willing to get vaccinated. I can't tell you about that 20% that you're talking about, whether or not that will diminish, but I'm hopeful that it will, and we're doing everything we can, certainly, to address first the people who haven't been vaccinated but have just been a little uncertain and unsure, and then, of course, finally, people who have been all along saying, I'm not going to get vaccinated, but may see that they have more opportunity available to them, or that they're going to be healthier and stronger if they get it.
There were some concerns about the reporting on people getting the second doses. There's like 8% that apparently people aren't getting it, but it might not be that they're not getting it, but that the computers are not talking to one another because people are going to a different area to get the shot from the same place. How does the state reconcile that? Does there need to be more work done by the state to get those numbers together?
Well, it's certainly true that there are people who got their first shot in one location and in one type of location, let's say a local public health department, and they went and got their second shot at, let's say, a Walgreens. And that as a result, at least initially, it's hard to reconcile that. It absolutely does get reconciled ultimately within the systems, within the eye care system, which is how we keep track of vaccinations. But it does take a little bit of time. So, we'll make sure that we're following up with people who we think have had one dose of vaccine and haven't had their second, to make sure they go in and have their second.
What about reopening the state? There are some who feel that your original plan that we picked those markers. Where do we stand on that of reopening?
Well, I'm pleased to say that we're making progress. You know that we had two sets of criteria, right? First, it was making sure that we got 70% of our seniors vaccinated, and then 50% of our total population, but also making sure that our hospitalizations are not increasing. And so unfortunately, just at the moment when we were about to tip to 50% of the population, 70% of our seniors, hospitalizations started going up, and so did cases. And that's very concerning, because we've seen this movie before. When they start going up, they tend to continue going up, and whether it's putting mitigations in or vaccinating more people, we need to make sure that we bend that curve and bring it back down again. As you have seen in the numbers, they've been coming down gradually, which is terrific. We have a period of time that we wait. I think it's another, I'll have to look at the IDPH website lately, but it's 5 or 6 more days of decline, which will allow us to move to the bridge phase and then on to phase 5.
Can I ask you as well about today, the census is going to announce if Illinois will lose 1 or perhaps 2 congressional districts. Why do you think people are leaving Illinois?
Well, which has nothing to do with the census itself, but I understand that's a trigger for everybody asking the question. Look, unfortunately, this has been happening for more than a decade, that we've had out-migration from the state. When I took office, this unfortunately had continued. And I looked very closely at the numbers of people, who they are, where they come from, why they're leaving. And what you see when you look at the out-migration is actually the largest portion of the population that was moving out were young people who were choosing to go to college out of state because they couldn't afford to go to college in Illinois. We weren't making it affordable enough. With all the effort, by the way, with MAP grants and Aim High, it wasn't yet enough. So people were being offered, some of our best students were being offered full scholarships to places like University of Alabama or University of Iowa, other places. So I immediately set out to address that with the General Assembly, and we did. We increased significantly the amount of MAP grants that are available to people, making sure that community college students were able to get more MAP grants than they had before, and making sure our merit-based scholarships, Aim High, were increased. So collectively that has helped. Unfortunately, as you know, just when that was starting to take effect, COVID hit. And for many students, it was difficult for them to go to college for their first year, for their first semester last fall. Either because the colleges had said, stay home, we'll do remote, or because they themselves said, it's not safe for me to go. But we're starting to see some relief and alleviation of that. And I want to point out that at least for 4-year colleges, we held relatively stable the number of kids who were going to four-year colleges in the state of Illinois. That hasn't happened. You know, for years before I became governor, the numbers were going down. So just getting to stable is pretty good. I'd like to see it going up. That's what we'd like to do. So that's a longer worded answer to a short question about what's making people leave. That's one large population that we're addressing, keeping in the state.
And do you believe there will be a map by June 30? Do you think you can get there that folks will agree? Might there be a lawsuit? What do you see ahead?
It's hard for me to predict. I will say this is a legislative endeavor, getting a redistricting map put together. We're certainly monitoring it, want to make sure that it gets done right, but it doesn't come to the governor until the legislature gets together and draws the map.
Governor, can you just talk about your
Okay, I'm sorry, I just want to make sure I get, yeah.
I just want on the census, just follow
Yes,
your
sir.
concerns about losing congressional seats.
Of course. I mean, I'm concerned about it. I will say that, over a decade, we've lost population. We've got to turn that around. We did the best that we could in counting people in the state of Illinois, better than any of the other large states in the country. And 7th out of 50 states in terms of just counting our population, doing a good job of that. So hopefully that will help us, but I can't tell you what the results of the census. I know we're going to hear later today whether or not we might lose 1 or 2 seats, but that's something that unfortunately before I became governor was really a bit set in at least clay, if not stone. And now we're working very hard to make sure that we're going the right direction.
All right, last question.
Craig.
Always happy to defer to another president.
Wait, but not to a Mary Ann? You wouldn't defer?
Always Mary Ann. She's at the top of the list. But seriously, we are hearing from landlords and their interest groups about the continuing moratorium on evictions.
Yep.
And some are saying now that the state is starting to open up, they want to see a little bit of easing in that, if not for people who are still struggling with COVID, but people who may have be squatters or people who were being evicted long before COVID. What can you say to those people?
Well, let me begin by pointing out that the reason that we put a moratorium on evictions in place in the first place was because here came COVID. Many people lost their jobs. It was not right to push people into homelessness at just the moment when people need to have a home, when they need protection. What we want to do is keep people from getting COVID. We wanted to make sure that they weren't having to, go into a situation where their families were out on the street. And so that's why we put it in the first place. We protected people from utility shutoffs. We protected people in so many other ways, providing them with testing, free testing, as well as free vaccines. We are certainly, now that the American Rescue Plan was passed and there is significant amount of money available for us to provide for renters paying their landlords. We last fall, we had the first installment of that, and we put in place one of the largest programs in the entire country. In fact, I think it's the largest to protect renters. That money, to be clear to everybody, goes directly to the landlord. It doesn't land in the hands of a renter who then gets to decide what to do with it. The renter and the landlord both sign up online, and the landlord gets paid directly. That will happen again because of the significant support that President Biden, Vice President Harris, and the American Rescue Plan have put in place. So we're about to do that. That will allow us to begin the process of, letting the normal processes take place.
All right, thanks, everyone.
Thank you.